From KETK, you're watching East Texas Live.
And welcome back to East Texas Live on KETK. Joining us now is Dr. Justin Bartley with Azalea Orthopedics. He's one of the few surgeons in East Texas who's trained to perform hip arthroscopy. Good morning. Thank you for coming on.
Good morning. Thanks for having me.
All right, no problem. So just kind of give a brief overview. How would you describe that procedure that we just talked about there?
Hip arthroscopy is a minimally invasive surgical technique that allows us to view the hip joint using a special camera and work through several small incisions to be able to treat the underlying cause of the pain or the underlying injury. The unique aspects of that is that we're able to work through several small incisions, it's minimally invasive, and it really relies on innovation and developments in the last decade that have allowed us to do that.
All right, so definitely sounds like a really important procedure there. So what are some of the main indicators that a person, that would tell a person that they maybe need that procedure?
Yeah, most common indication is a labral tear within the hip. And often that's a result of impingement within the hip socket. Impingement is basically abnormal contact between the ball and the socket of the hip that can cause a tear of the labrum, which is a ring of cartilage around the hip socket. Once that's torn, it's very, very painful in the growing of the patient. It's also exacerbated and worse with physical activity, participation in athletics, or possibly even simply sitting at times. It can be quite debilitating for a lot of our patients.
All right, so for someone who goes through this procedure, how can it kind of benefit them like post-surgery and like life after surgery?
Absolutely. So we always attempt a long, extensive course of non-operative management first, if possible. If the patient is amenable to that, we try physical therapy to try to help with the pain that they're having. If that doesn't work, well then arthroscopy, hip arthroscopy, can help with the underlying pain. But there's also been several studies that have been published in the last several years that show that it can actually halt the progression of arthritis in a young person's hip.
Okay, so there you go. Definitely sounds like a really important preventative measures there, and then important surgery as well. So just tell me, do you have any new innovations your specialty is practicing?
Yes, hip arthroscopy is one of the fastest growing and developing areas and subspecialties within orthopedics, which makes it very exciting. There's several areas of that we do at Azalea Orthopedics that make us a leader in this field. One is the ability to use a special table to be able to do hip arthroscopy without a post, which has only been developed in the last couple of years. It really makes it a safer procedure for our patients. It's called postless hip arthroscopy. The other aspect is that we're able to model the hip using a CT scan before surgery so that we can see not only that the patient has a labral tear, but the underlying impingement that caused that labral tear. So we can treat the labral tear by fixing it during the case, which is a labral repair, but we also treat the underlying impingement to help lower that patient's risk for recurrent tears in the future.
All right, so definitely some great scientific advancements there, certainly within the past years, and great to have it in Tyler and the surrounding area as well. So for more information, you can go to azaleaortho.com. Thank you for being here.
Thank you for having me.
All right, no problem. We'll have more news and weather for you after the break.